Welcome back. So today we're going to be talking about something very special. Is it possible for a lady to still see her regular menses while she's pregnant? The answer is a yes or no. So let's go there through the discussion. We'll get the right answer. So we want to first start with the cycle. So the cycle is divided into 4 different phases. So from the discussion we'll understand. Now, the first phase is the menstruation phase, and the menstruation begins from day 1 of your cycle length, that is in 28 days. With 28 days cycle length, menstruation begins from day 1. It might be up to 2, 3, 4, 5 days or up to 7 days, but it's expected to be at this period. So after menstruation, the next phase, that means menses cease. Your next phase is considered as the follicular phase. So follicular phase is expected to start from day number 7, between day 7 up to day 14. This is the point at which the ovary is forming multiple sacs that will release eggs. So after that phase, you get the ovulation phase. Ovulation phase is a time where the egg is released, and that time is around day 14. So around day 14 can be day 12, 13, 14, or 15, 16, between there. So ovulation can happen, which is the release of egg. So after the egg is released, after 24 hours, it is reabsorbed. And when it's reabsorbed, between that time up to the next period that will start again is considered as a luteal phase. And that phase lasts between day 15 to day 28. So, menses, how does menses happen? Let's understand the mechanism of menses and compare it to pregnancy to see whether it's possible that someone can see that menses during pregnancy. Okay, so we'll go to follicular phase. Now, during follicular phase, when the follicle is forming the sac and to release an egg during ovulation, what happens is that you have the hormone level, estrogen and progesterone. They will increase, and the increase of estrogen and progesterone will allow the thickening of the endometrial lining. So inside the uterus, the wall of the uterus will get thick. So that means the womb is prepared to receive fertilized egg from the ovary. So after the follicle sac is formed and the egg is formed, during ovulation, around this day, when the egg is released and then fertilized, is a different thing. But how does menses happen? So once the egg is released, if this egg is not fertilized in this fallopian tube, what happens is that estrogen and progesterone will now drop. And the dropping of estrogen and progesterone is what will lead to the removal of the substance from the endometrial lining. And as they will be removed, they will come out like this as menses. As they are removed, they're coming out as menses. And this phase is considered as the menstruation phase. So around 1 to 3 or 4 days. So that's how menses happen. Because estrogen and progesterone drop, since fertilization did not occur after 24 hours, the egg was reabsorbed and estrogen level dropped. So all the thick substances, they came out of the uterus as menses. Okay, let's go back. In the case of pregnancy, how does bleeding happen? So we still consider that during the follicular phase, estrogen is higher and the wall of the uterus is thick. So what happens next is that whenever the egg is released and then fertilized, this fertilized egg will travel down and come to implant into the uterus. So once the egg starts to get attached to the wall, because the wall is already thick, prepared to receive the fertilized egg for implantation. So once the egg is the egg is fertilized and it forms what we call embryo. So the embryo now come to get attached to this uterus. So we call the attachment implantation. So the implantation process, this process of implantation can lead to small bleeding. So you see the woman will be thinking maybe she's in her period or seeing her menses. So most women are aware of implantation, but some of them are not aware. Some women are not aware. So the attachment of the egg at this point will lead to bleeding. And what will make the egg to be attached here is that estrogen and progesterone level will remain very high. They will increase. So the more estrogen and progesterone are high, the more all of the uterine lining will become very attached to the wall of the uterus. So it cannot allow this endometrial lining to share out anymore because they remain high. So it's not possible for menses to happen anymore. So bleeding will happen. So what are the factors that will lead to bleeding? Especially in the first trimester, the first 3 months. So one of the factors include implantation bleeding, which is this one. So now that this embryo is attached here, and the attachment process will take a few days, and you will experience minor bleeding like this. So that's one. Another one include cervical changes. So the bladder hormone has a way of making the cervix vulnerable to bleeding. That's why we tell people who are in their first trimester that do not get involved into strenuous exercises, and also do not get involved into early intercourse, because intercourse will cause trauma to the cervix, and the cervix is being prone to bleeding. So the tissues are very soft there as a result of the vital hormones. So anything that hits the cervix will cause it to bleed. So the cervix can easily bleed. The cervix can easily bleed. So the bleeding can be as a result of maybe the gland penis hitting the cervix during intercourse. So sometimes if it is very raw, the intercourse itself can lead to trauma that will interfere with the attachment of this embryo to this uterine lining, and it may end up coming up. Miscarriage will happen. So avoid intercourse during your first trimester. That's 2. And the next factor is subchorionic hemorrhage. Alright, so now that the egg has been implanted and developing into a fetal, you will have the attachment of the placenta to the uterus and then attached to the sac where the fetal is. So between the sac, because the sac is also attached to the wall of the uterus. So between the uterus and the sac, sometimes there will be some minor bleeding because the attachment, there's a little opening between the attachment, almost like you have something attached to something here. Alright, but instead of it being close like this, there is minor opening here, and bleeding will start happening like this from this point. So at the attachment point here, you see the minor bleeding start to happen, and you start experiencing it. Sometimes these things happen monthly. So that's why we advise pregnant women avoid too much strenuous exercises, especially in first trimester, your first 3 months. Avoid too much heavy weight, too much riding of bike that will make you bounce. Most times it will not cause abortion, but you experience some kind of minor bleeding. So sometimes when you see it every month and they think they are having menses, it's wrong. The mechanism of menses ceases as long pregnancy is present. Alright, so that's subchorionic hemorrhage, that means bleeding under the sac from the attachment of the uterus. Alright, the next one involves ectopic pregnancy. So most times you realize that the egg was fertilized and the embryo remains here and wants to develop within this tube. So where the egg wants to develop is not where it should be developed, because the tract cannot be developed and formed. The tube is small, the environment is narrow. So this can cause rupture of vessels either at the fallopian tube or with the egg sat inside the embryo, and bleeding can occur. So the bleeding can start occurring from here and then into the uterus, protruding outward gradually. That's how ectopic pregnancy will cause bleeding in pregnancy, and this is associated with pain. So you will know that it's something different. Okay, so with the first trimester, these are possible factors that will lead to bleeding. But let's look at second and third trimester. What are other causes? So some other causes will involve placenta causes. Example, we got placenta previa. Placenta previa is the placenta covering the entire cervical pathway instead of being at the fundus. So in short, the placenta comes before the baby. It's supposed to be up, the baby can't inform, but the placenta is down and the baby is up. So that means the placenta left where it's supposed to be attached and below here. So this can lead to small bleeding. And at the end result, that condition can lead to surgery. They will have to operate on you so that you can continue bleeding and loss of blood. And this may lead to death. So that's one factor. Two, we have placenta abruption. So the abruption process is when the placenta is leaving the wall of the uterus, because it's usually attached. So when it's leaving the wall of the uterus early and going downward towards the cervix, the process of detachment from the uterus can lead to bleeding. And it happens gradually. So most times people see, they think it's menses. Sometimes you might not have that, you might not have pain. So they see that it's menses, it's not menses. Go for ultrasound, go and see your gynecologist, and let them detect the cause and attend to that. One other cause can be chronic infection. Chronic infection. Sometimes the infection within the placenta itself is bad. This is why we advise pregnant women to always go to hospital monthly so that they will check you. So chronic infection is one factor. Alright. One other cause is vasa previa. So vasa previa is the blood vessel of the fetus that runs through the membrane are covering the cervix, which is almost like the amniotic sac. In case of any rupture in that sac, those vessels will bleed, and the bleeding will be seen like menses. It's what will cause harm to your baby or even the mother. So most times we advise you always go for your ultrasound, go and be assessed properly. Do not assume that you are seeing your menses regularly. There are a lot of causes that can lead to bleeding during pregnancy. So let us not get it wrong. No one can see their menses during pregnancy. Any bleeding could be one of these causes. Go to the hospital and see your doctor. Thank you so much. Let's follow for more knowledge on this page. This is Audacious Dennis, your presenter and content creator. Thank you.